guys are taking. Yeah, so when you're frustrated in school, just remember there is a reason for it, and it takes you a long time to realize it. Or it took me a long time, I should say, to realize that. But once you realize that, yeah, you got to learn some of these things. I mean, you're going to have the term doctor next to your name, and you're going to be expected to answer a lot of people's questions and answer their concerns about it. So put in the work, and then you'll be able to do that fun, cool stuff. And then it's really fun when you get to place multiple implants and make a bridge across there and just completely transform someone's life. It's really rewarding.
So Paul, what were some things that Dr. Blaisdell, what were some things that you were glad that you did before you went to dental school? What are some things that were helpful, you think, in not only your application process, but becoming a practitioner?
Okay. A lot of the job of being a dentist is talking to people and being able to communicate. As a tutor and an academic advisor, those were my jobs. And I was an orientation leader for a little bit at Boise State. Those are all jobs that involve talking and communicating and problem solving to help other people. If you can cultivate that desire to help other people, and you can practice your people skills in a work environment of some sort, or just for anything, when you're volunteering, if you're doing volunteer work, make sure, try and, use some of that time to be around others and be a team player. Those are definitely personal attributes that I feel helped me through dental school and are certainly helping me every day now as a dentist. Any hands-on that you can get. I was lucky enough, my brother is a dental lab technician, so he makes the crowns for people. And I was lucky enough to work at his office and get some hands-on experience there. And, having the opportunity to go shadow other dentists, I shadowed other specialists, and just to really get a kind of mix of what I wanted to, get a clear idea of what I wanted to do. Even though I was pretty sure I wanted to be a general dentist, I still went and saw an oral surgeon. I still went and saw an endodontist just to check it out. But you kind of get an idea of what you want to do, because once you have that vision of what you want, if you want to be that orthodontist and you got to, it's a lot easier knowing that you got to go into dental school, knowing that you're going to have to work your tail off to be top of your class. If you have that direction, and then you have that practice, and you kind of immerse yourself in different aspects of dentistry, and it'll help you feel more comfortable when you get there and are exposed to new things. And as far as application goes, I mean, if they have minimum requirements for community service hours or shadowing or anything like that, do that and then some. Go above and beyond in what you're doing, because there's a lot of competition. It's not, not everyone knows like I do that Boise State students are the best. Some other schools think their schools are okay. Whatever, let them think that. But coming out of Boise State, I mean, if you do take the path that your advisors tell you, work hard, and especially the science classes. I know you have general classes, especially you guys that are first year. You have a lot of general classes that you just kind of have to do. But writing that English paper and having the discipline to do that, yeah, you might not end up writing a bunch of papers. You might end up doing a bunch of research in dentistry, who knows? But a lot of it is having the discipline to do it and organizing your time. Start forming those habits now in your first year, because then it will only be easier for you as school gets harder, because it's going to get harder every year. It's kind of an uphill thing, especially in dental school. The first couple of years were super hard on me, but once we got into the clinic, I felt like it kind of evened out. But a lot of those discipline and those habits that you form now, they're going to help you throughout the whole process.
Yeah, I actually wanted to ask you about the dental school. I know that we've talked about how they were kind of different the first 2 years and then the last 2 years. Could you maybe talk about like the difference between them?
Yeah, so in my case, it's different now. When I went to school, you had the whole purpose of going to school is to pass your boards. And and when you're learning in dental school, I mean, really, you're learning just enough to not go out and hurt people. There's so much more to learn, and that's where continuing education and always being a student is going to help you. But those first couple of years for me, it's just super, super heavy loaded with classes. I mean, you are in lecture all day and then you study at night, and that's just how it is. At Creighton, after you get through your first 2 years and you pass your written boards, you are then authorized to start working in the clinic. You start seeing live patients and cleanings. And I mean, your first day, my first day in clinic, I walked out and did a root canal, and I had only ever done them on plastic teeth. Because your first 2 years, like I said, they are classroom instructions and they are lab work on plastic fake teeth. That's the only exposure you get. And then I mean, you get to clean people's teeth once in a while, but I mean, your first day, you could walk in to the oral surgery rotation, your very first day at Creighton at least, and you can go in and pull someone's third molars. You know, it's going to take you a long time because you've never done it, but they just kind of throw you into the fire. So 2 years academics are academic heavy, getting you ready for the written boards. And then the final 2 years are clinic heavy, getting you ready for not only your second portion of written boards, but also your clinical boards. That's the different states require that you take different board exams to certify and be able to practice in their state. So that was the difference for me. Now, I'm not exactly clear on it, but I believe now dental schools have their written boards after the first year. It's either after the first year. At some schools, they do it after the first year, or they just have one set of written boards now rather than two, which is super helpful. I'd have to double check that. Obviously I checked out of school, right? So I don't know the exact process, but for me, yeah, the 2 years heavy academics, and then the second 2 years are heavy clinical, with some academics, obviously. I would actually, yeah, I need to look into that and see what the requirements are now for the board exams. Aaron, do you know off the top of your head what they are?
No, that would be something we have
No.
to talk to Dr. Jorgenbergen about. So
yeah, we'll ask him about that. So I still think at Creighton, I believe that you are taking your board exams after your second year to get ready for the clinic. But I think it's just one set of written boards now rather than two. So yeah. What else you got? I'm an open book, guys. Anything you need. Does anyone think they want to specialize in here? I'd be like an endodontist or an oral surgeon.
I was thinking of doing pediatrics, but we'll see how I feel about that after 4
Yeah, definitely. Yeah. I have 4 kids at home, so I was like, no, I don't need to be a pediatric dentist. I'm okay. All right, I got enough of them at home.
That makes sense.
That's great though. Peds are great. There's a lot of opportunities. There's a lot of opportunities to be a pediatric dentist. You literally can pick and choose wherever you want to work in the country. They'll take you because there's pediatric dentistry is. I don't mean this in a negative connotation. It's very business driven, is pediatric dentistry, because with pediatrics, a lot more insurances pay a lot more things for kids. And then it's a lot of times there's not enough pediatric dentists around. Right. So if that's the case, they're always looking for more. I don't think there's ever a saturation of pediatric dentists. I don't think there ever will be. You can never have enough. Because even the ones I refer to around here, even they are super busy all the time. So that's great. Anyone else? So Rachel's she wants to be a pedo. Anyone else want to do anything? Yeah, Zach?
Yeah, I'd love to be an orthodontist. I know that one's pretty tough to get into because a lot of people go after that, but I think that'd be awesome.
Ortho's great. I do. Here's the thing: is I'm a general dentist and I do Invisalign, but I can only do very basic cases. I know my limits. I only move the front teeth around. But yeah, ortho's great, man. It's challenging. It was never my cup of tea, but that's also something where if you guys have any if you have any experience in business or anything like that, it's super beneficial. Because going back to what Aaron said, something that I wish I would have done preparing for dental school, I wish I would have had more business exposure. Some of those general classes or extra classes that I could have taken, I wish I would have learned a little bit more about business, finance, things like that, because it's very little what you get in dental school, at least in my experience. It's very little what you get in dental school as far as how to run a business. You're going to come out knowing how to treat a tooth and how to, take care of someone whose face, half of their face is swollen. You're going to know what to do. But how do you run QuickBooks? How do you do payroll? All that stuff. It's going to be it's going to be challenging for me. I'm excited for it. That's why I want to be a business owner. But yeah, orthodontics, man, that's a good one. That's going to be tough, but man, you can do it. Boise State's got you ready. You're going to be fine.
Did you happen to work? You didn't work during dental school, did you? Did you work during?
No, I didn't. A wife and 4 kids. That was definitely my job outside of school. But there's a lot of students that did, especially, like I said, dental school kind of goes like this the first 2 years, and then you kind of learn how things go, and then it kind of evens out. When you're in clinic, things are kind of rolling. At least for me, it got a lot easier when we did more clinical stuff rather than written stuff. By my 4th year, I had quite a bit of extra time on my hands. And a lot of students would use that time to work. Some of them did assisting. They would do moonlight assisting at a dental office. So they'd be chairside helping the dentist and they know how to do that. I mean, you're inherently going to be taught how to do that while you're in dental school because you're going to spend part of your time assisting your classmates. So they would go help this dentist out and assist for him, and then they'd pour up models and they'd take photos for him and things like that. So there, I had a buddy of mine who did Uber driving on the weekends, and he would, in between waiting for rides, he would just sit there on his phone and do his board preparation studying, because they have the apps that you just do like all the practice tests, and he just sit there on his phone waiting for an Uber or a Lyft ride, and then he'd go do that. So everyone's a little bit different. Yeah. What else you guys got? Anything at all?
If nobody's gonna go, I guess I'll talk about the competitiveness of why you're in dental school. I remember you talking about how like you're with your peers a lot, you get to know them a lot, and then you were going on about like how some of them you've had problems with some of them before, or there's because of this specifically.
Yeah.
Talk a little bit about that, please.
Yeah, man. There's people. I mean, it's every facet of life. I mean, there's people that are tryhards and they'll do anything to get to the top. The very vast majority of my experience of dental school is very positive with my fellow classmates, but I had some people that just flat out, they don't like me. They don't care about me. There's people that just, all they want to do is get to the top of the class, and they're going to do anything they can to do it. And it can be kind of cutthroat sometimes, but you had people that would go in at the end of the year, at the end of the 4th year, you would have people going in weekly up to the dean's office to check their rank and see where they're at. It was that bad sometimes, man. And how someone can live like that, I have no idea. I wanted no part of that. But yeah, the competitiveness, for the most part, it's healthy, but you're going to have a few bad apples in there. So if you're wanting to specialize, just keep your head down, do your thing. If you treat, I've always found that in school and in work, if you're honest and you just treat everyone around you with respect, you're going to do great. You're going to do just fine. No need to be cutthroat. No need to lie. There's just keep your head down, be humble, treat others with respect, work hard, and it works out really well as far as my classmates went, and now working with the general public. Yeah.
I have another question.
Yeah, go ahead, Zach. Go for it.
I hear people say like what you learn in school doesn't exactly carry over to having a real job. Like they're kind of different. How well did you feel you were prepared with everything you learned in dental school to tackle being like an actual dentist?
Well, I yes and no. I mean, obviously, school is going to teach you how to diagnose and treat a vast variety of things. I would my initial reaction to that comment is that there are 100 ways to do the same thing in dentistry, and there's oftentimes 50 different products that you can use, and you know, my product of choice, my filling material of choice, or my method of doing things might be different than from someone else, but we're going to accomplish the same goal. And it also really depends on the dental school that you go to. If you go to a school that is very heavily invested in research, you might not get a lot of clinical exposure that would get you ready for the real world. A direct example of that is if you go to a school that has a lot of residencies. So if you go to one of the big schools, just off the top of my head, if you go up to UW, for example, I have one of my classmates is doing his oral surgery residency up there right now. He's in the middle of it. If you go up there and go to school as a dental student, when Joe Schmo comes into the clinic and he needs 4 wisdom teeth taken out, that gets taken right up to the residents. That goes right up to the oral surgery residents, and they get to do it. Now, if you go to Creighton or a lot of other schools, and that guy comes in, he goes to you, because we don't have residencies at Creighton. So you get to do all the root canals, all the oral surgery, place all the implants.
Place that you want to do. Nope. Can you guys hear me still? My things died. Can you guys hear me?
Yeah.
Okay. Anyway, so yeah, at Creighton, when you do the clinics there, you get everything. You get the hardest cases. You get everything thrown at, and you get specialists right over your shoulder. You get endodontists that are going to help you with that help you do that root canal. You get an oral surgeon right over your shoulder teaching you how to do that stuff. And so when I came out of school, I felt very comfortable with a lot of stuff. I could come out, that implant that I showed you guys today, I could have done that day one coming out of school because I went to Creighton and because I had that experience. Not everyone can say that. And that's okay, because some other schools, they're more invested in research or their residents, because that also gets them, a lot of exposure, and the world needs a lot of specialists. So like I said earlier, school will get you ready to go out and be a good dentist and pretty much not hurt people, but it's up to you to really delve in, because there's always going to be a better way, a better method of doing things. Or a better, maybe there's a better technique, a better tool, something that works better in your hands that you weren't exposed to at school for one reason or another. A lot of schools take the approach that, well, if they can do this with our stuff, when they go out into the real world, they'll be able to handle anything. I know that the Creighton I went to, our building was built in 1970 something. Right? Back then it was state of the art. By the time we were the last class to graduate from that old building. And man, it looked like an old building. It was an old 1970s building, like tile coming up from the floor. So the new building is nothing like that. It's gorgeous now. It's beautiful. And yeah, so, but regardless, even though the building that I went to wasn't the prettiest, I still got the exposure that I needed to be able to do everything that I wanted to do coming out of school. And and the equipment that we used there wasn't the newest and wasn't always the newest or the nicest. But when I came out of school and I came to work here in CUNA, they had everything that I needed and then some, and it worked great. But it's on you to get out there and to learn what you want to do and to take the CE courses that you want and to get perfect at whatever you want to do. Or not perfect, I guess, to get better at whatever you want to do. Did that answer your question a little bit? That's a lot of words. Sorry, Zach.
No, that was a great answer. Thank you.
Yeah, definitely. Coming out of school, work was great, but when you're first coming out, you're slow. You're super slow. What 1 or 2 fillings took me an hour when I graduated from dental school. And, after a few years and just repetition and doing it again and again, I probably 15 minutes now, depending on the case. You just shorten that. And that's how you pay the bills. If you're going to be as slow as you are coming out of school for your whole career, it's going to be hard to pay off that debt. So it's up to you because a lot of your payment based on an associateship, it's based off of what you earn or what you produce, I should say. You get a certain percentage. So if I do a filling that costs $150, my payment before taxes is like 30% of that. So it's like $49 is what I get paid to do that filling. And then I get taxed on top of that. And that's just the life of an associate. So it definitely helps to get better, to get faster as soon as you can.
All right, if we have one more question, I think we're nearing that hour mark, and you want to be cognizant of all of your times. We know you guys are really busy with school, and we really appreciate Dr. Blaisdell coming and chatting with you all. Is there another question? One last question, one final question? All right.
In the chat, Aaron, I'm just going to put my phone number. So anytime you guys have any questions, if you guys want to come out and shadow, see something fun, please feel free to either text me or here's my email as well. If I can actually type the dang thing. Yeah, just shoot me a text, shoot me an email. I'm an open book. Anything for a Bronco. I'm always here to help you guys. Yeah, and even after you go to school, keep in touch. Who knows? Maybe my practice will do great in a few years, right? Rachel and McKenna, maybe you guys will be looking for a job here in Idaho. Yeah, just hit me up. That's all good.
Maybe you'll need a pediatric dentist.
Oh, please come see all the kids. Please, I'll welcome you.
Dr. Blaisdell?
Yeah.
You also know like people you could send out, like we were trying to branch out to other people, job shadow too, like other than general dentists as well? Alrighty. You tell me
whatever you want to see. I know them. So endodontist, oral surgeons. One of my classmates, she is not a pediatric dentist, but she works at a pediatric office. So she graduated with me, but she works in Boise at a peds office. And so she's fantastic too. She's always, and she went, she went to College of Idaho, but she's from Boise originally. So yeah, lots of contacts. Anything you need, anyone you want to see, any specialty, any procedure, anything you want to see, just let me know and I'll do my best to help you. Absolutely.
Well, again, thank you so much again, Dr. Blaisdell. We really appreciate it. And we're excited for the summer. I'm sure everybody else is, to be able to kind of maybe get some experiences no matter what they are. So thank you so much for your time. Again, group, just a reminder, IDEP, even if you're not an Idaho resident, please come to that presentation. It's on April 6th, I believe, at 2 o'clock. We also have Utah coming in April. We also have Midwestern coming on April 8th. We have, and I should have Rosamond's program set up as well. So if you are looking for more dental schools to hear from, these are kind of the ones that we were able to get a hold of before the semester gets out. And then at the end of the year, we always host the pre-dental panel, which we will have 3 fabulous students who are accepted to dental school this year. We've had an 80% acceptance rate for all of our dental student applicants this year. So if that tells you anything about our Boise State students, they rock. But we will have 3 at least students who will be able to talk about the experiences that they had this year in the application process. So thank you again, everybody.
Thank you, Dr. Blaisdell.
Thank you.
you.
Aaron.
Oh, my pleasure.